to your special program. Let's talk about infertility openly. Today we'll be talking about misconceptions about fertility. Well, so people have called it myths. What is a myth? A myth is a wrong belief, and people have called it a half-truth. And very quickly, I want to look at 5 common myths or 5 common false beliefs about infertility. Number 1, infertility is a woman's problem. There can be nothing further from the truth. As the saying says, it takes 2 to tango. So infertility cannot be a woman's problem. Maybe because the man carries the pregnancy, and then we think many times it's the woman. But what we know is that if you have 100 couples that have a challenge with conception, 30 of them it's because there's a factor with the woman. Another 30 is because there's a factor with the man. Another 30 is because there's a factor with both the man and the woman. And then we have a 10% in which nothing is wrong with them, but for some reason they're still having challenges with conception. Another common myth we have, or another common misconception we have of infertility, is that if a man can ejaculate, he cannot be infertile. This is not necessarily so. In fact, this is not so. Because it's not just enough to ejaculate. The sperm sample that we have during ejaculation, it contains some sperm cells that look like tadpoles. And these sperm cells are actually what swim in to go and fertilize the egg and then result in a conception. So if for some reason there's a problem with the sperms, maybe the count is not enough, or they can't swim enough, or they appear abnormal, then this will result in a challenge with conception. So the fact that a man can ejaculate does not mean he is fertile. Another common misconception that we have with infertility is that, they're a young couple, they cannot have fertility challenge. That is not so. That is not so. Infertility is like a medical condition. The same way I cannot say a young person cannot have hypertension, a young person cannot have diabetes, a young person cannot have an eye problem. The same way. Yes, I agree that as people grow older, the problem with fertility concerns, it increases. I agree. But the fact that someone is young, a man is young, a woman is young, does not mean there can be no fertility challenges. So I tell my people, after 12 months, maximum 24 months, you'll be trying to get pregnant and it's not happening. Please see a specialist. Another common misconception we have about infertility is that if I've had a child before, I cannot have a delayed conception. This is not so. It depends on several things. For instance, if a woman has a child when she was 34 and the child is now 6 years old, the woman is now 40, her fertility status at 40 is not her fertility status 6 years ago when she had this child at 34. So the fact that we're growing older compromises our fertility chances. Apart from that, at times medical conditions has progressed. Maybe I had endometriosis and that has gotten worse. Maybe when I had a C-section, I had an infection and blocked my tubes. Maybe something happened. You understand that? So both for men and wherever it is, once you've tried to get pregnant for 1 year and it's not happening, regardless of the fact that you had a child before or not, please see a specialist who can counsel you properly on what to do. Another misconception that people have is relax. It's because you are anxious. Once you relax, the pregnancy will come. But you see, it depends on what is causing the delay in conception. If the delay in conception is from blocked fallopian tubes, or it is from abnormal sperm parameters, or it's from poor egg quality, or it's because the woman had reached menopause, relaxation will not solve that problem. Relaxation is not necessarily the solution. Please see a doctor. They will request for some basic tests, and on the basis of that, they can counsel you whether to relax or not to relax. I've said a lot of things today relating to misconceptions and myths about infertility and fertility treatments. I really do hope you learned something from it. I'll be very glad if you have. Till we see you again, have a fantastic day.